Hey guys, welcome back to the channel. This is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and the Light Away in Huntsville, Alabama. Today, we're going to be talking about the Inpen, a new device to Medtronic. It's been out on the market for a while, but Medtronic really recently acquired Inpen, and we're going to spend some time talking with Jake, who's one of the trainers. Let's get started. Well, Jake, thank you so much for joining us. We're so excited to have you with us today. There are so many people that are suffering from diabetes, and it's becoming such we're not using the word pandemic yet, but it's becoming such a great issue in our country and in our world. We're glad that you took some time to spend with us today.
Yeah, thanks for having me. I've enjoyed getting to know you over the last few months, and I'm excited to be here.
Awesome, awesome. Well, let's get to it. So there are 34.2 million people in the country, in the U.S., that have diabetes, and if you believe the statistics, the World Health Organization says that there are between 400 and 600 million people in the world that have diabetes. So it is a huge issue that we see, that we fight.
Yeah, and I would say that there's a large portion of people out there that are diabetic and don't even know they're diabetic. So I think those numbers will probably only continue to go up, uh, at least for the time being.
For sure, for sure. And with all of the treatment that we have, I think the statistic is that about 33% of people who are diabetic still are not achieving the goals that we want them to in terms of glycemic control. And so we're always looking for new and exciting ways to try to get people at goal. And so, technology continues to improve, medications continue to improve. And I was very excited when I first found out about the Inpen, and even more excited when I found out that Medtronic had acquired the Inpen.
Yeah, so that's a great thought. Medtronic for years and years and years has been known as the insulin. Medtronic Diabetes has been known as the insulin pump company, and that's been so true. And Medtronic has changed a lot of lives with insulin pumps. But we know that only 30% of all diabetics, all type 1 diabetics, are on insulin pumps, and even more than that. Only 7% of diabetics in general, type 1 plus type 2, are on insulin pumps. So many patients are still taking shots, and so many patients are still not at goal.
And so, when we talk about shots, we use this phrase multiple daily injection, right? So MDI. And for those of you who are watching, that simply means that patients are doing injections, right? So they're doing multiple injections per day, as opposed to being on an insulin pump that routinely gives them that insulin. And one of the challenges, and I'll just jump right into it. One of the challenges that I find sometimes in managing patients is that it's hard to know exactly what insulin they took, right? So they think they took 5 units, or they are supposed to take 10 units, but they're not sure. And when patients come to see you every 90 days, 90 days ago, that's a long time, right? So they may not
Yeah.
remember. So tell me about the insulin pump. About the insulin pen, the Inpen. What is it? What makes it so fascinating as new technology?
So the Inpen has the slogan of the Inpen is to guess less and live more. So to get the right dose at the right time of your meal. I'm not diabetic, so when I am about to eat a meal, I think about how delicious this meal is going to be. But sometimes diabetic people look at a meal, and a math calculation comes in their head. That's where the Inpen can come in. It has a dose calculator on a free app on the patient's phone. So based off the patient's blood sugars, when they open up their app, the Inpen app it's a bolus calculator. So the patient, it takes all of the guesswork out of how much insulin does this patient need for this meal that they're about to eat, and even more, based off the active insulin that's in their system, which the Inpen app tracks as well.
Right, right. Well, look, why don't you go ahead and hold that up for us, and let's let our folks see what the InPen looks like. Now, this pen looks like a typical insulin pen that someone would get when they get, their prescription from the pharmacy. What makes it different? Can you open it up? Show us a little bit
Yeah,
about what makes it different for us.
so as far as the patients go, it's not a lifestyle change at all. So this is the cap of the pen. They would simply take the cap off, and they would drop an insulin vial into the pen. So that's really the only change the patient does. Rather than getting a pre-filled pen, they will get a pre-filled vial. And this is a permanent pen. The pen will last an entire year with no charging, no need for anything. And they will simply put the cap back on, and they'll dial up their dosing just like they already were with their other pens. But that's after they use the Inpen app on their phone to determine how much insulin they need.
So really, there's not much difference other than you've got a permanent pen, you put the cartridge in, and everything else works like a regular pen that they use
Yep.
for their multiple daily
Yep.
injections.
Yep. Whatever needles they're already using, it should work on this pen. It's very versatile. So again, it's not a lifestyle change for a patient. It takes the guesswork out of their therapy, and it takes the guesswork out of when they're about to eat. How much insulin do I need? Do I need to use a sliding scale? They don't have to anymore. They have a free app on their phone that tells them exactly what they need. So, what we think at Medtronic, what should patients not do? We believe they should not have to calculate doses in their head. We believe they shouldn't have to log anything on a piece of paper. And the doctor, being a clinician, you've probably seen it over the years. Patients come in and they have no logging. So how do you make any kind of therapy adjustments or decisions if you can't see their blood sugars? We believe patients shouldn't have to wonder if they've taken insulin. They have the log on their phone. So these are just a couple of the ideas that Medtronic had when they purchased this. And when the first smart pen was developed in Inpen, there's a real need for patients to have better therapy.
Okay. And so as you think and as you guys are positioning the InPen, what really is your ideal patient?
There's really two ideal patients. The first ideal patient would be a newly diagnosed patient. So in Alabama, I'm not sure how the rest of the country is. In Alabama, a patient cannot have an insulin pump until they have done 6 months of multiple daily injections. So that would mean they are taking, like as you mentioned earlier, 3 to 4 shots a day. So they take their basal insulin, their Lantus or their Tresiba, Basaglar, whatever it may be, and their mealtime insulin, which was where the Inpen would come in. So a newly diagnosed patient, learning insulin and learning how to calculate insulin can be extremely difficult. And that's where this can really help. So on top of that, they can get their 6 months of MDI. And if they want to move on to an insulin pump, as you might want them to as their clinician, they can do that. But they at least know technology of diabetes, and they at least know insulin tracking and how active insulin works. And they at least know how to calculate for a meal. So the first patient I would tell you is a newly diagnosed patient that needs insulin. The second patient I would tell you is somebody that simply doesn't want to go on a pump. We hear you've heard it, and I've heard it in your office. I've heard it in many offices. Some patients say, "I have no interest in going on a pump. I don't like the feeling of something being attached to me all the time." And you know what I say to that? I say, "That's your decision. We have another really cool option for you. We have a smart insulin pen that can help you get the right dose, and it's very affordable. And Dr. Woode can get real-time reporting out of this pen, out of the report on the app. So it's a superior option than just taking normal shots. And for people that don't want to be on a pump, that want to just be on their normal shots, this really is a no-brainer.
And so you're saying that any of their bolus insulins can be used in the InPen. Can you use, Humalog, Novolog, I guess Apidra? There's some newer
So,
models on the market now.
so great question. Right now, it is just approved for Humalog, Novolog, and Fiasp. Now, I have no idea what the future is going to be on that, but we at least have three. So if a patient is on any of those three, they would qualify for the InPen. If they were on Apidra or Limjev, then they could potentially be swapped over to one of these three, and they would still qualify for an InPen.
Okay, all right. And do you have any data as to what patients are experiencing in terms of time in range, glycemic control, A1C's improvement with the InPen?
We have patient reporting, we have patient testimonials, but the real statistics that I can speak to you on why physicians should be putting more of their patients on InPen are some alarming statistics that stick out to me. Is 2/3 of patients taking insulin need help calculating insulin. The InPen app can do that. 60% of patients that take their insulin with some active insulin on board, putting them at risk for hypoglycemia. Uh, Another statistic that we talk about is a bolus calculator is associated with a 1 point drop in A1C. So those are the statistics that mean something to me, and that I believe would probably mean something to you as a clinician. But yeah, we do have patient testimonials, and that's how. Yeah.
So you mentioned a couple of things there. So active insulin. What for those who may not know what that means? Tell us what that means.
So active insulin is, as far as mealtime insulin goes, Novolog and Humalog, that is from the time of that dosing, that insulin is active in your body for roughly around 4 hours. So for those 4 hours, if you take a meal, if you eat again in 3.5 hours, the app will account for that insulin you took 3.5 hours ago, avoiding you from going into hypoglycemia by giving too much insulin on your next meal. So
So
active
so it
insulin is simply the insulin that is active in your body.
Okay. And so the app kind of keeps track of that and says to you, hey, you took, 4 units 2.5 hours ago. You still have this much on board,
Yep.
and basically helps you from going overboard and giving more insulin
Yep.
and going hypoglycemic.
Yep. It does the correction for the patient. So the patient, again, it takes all of the guesswork out of their life. It takes the risk out of their life, in my opinion, of giving themselves too much and going low.
Now, one of the, I guess, I don't want to say buzz phrases, but everybody's talking about integration, continuous glucose monitoring. My understanding is that the InPen is connected to Medtronic's Guardian
Yep.
sensor. Is that correct?
Yeah, it connects it connects with Medtronic's Guardian Connect, and it also connects with the Dexcom. So we don't want somebody that's not in the Medtronic family. We don't want that to be a reason that they can't get the InPen. So there is a partnership with Dexcom as far as CGMs go. Um, CGMs have changed the face of diabetes, as I've seen, and it's almost hard to imagine what life was like before we had real time data, and it you can attest to it. But yeah, the InPen does connect to the Guardian Connect, Medtronic's CGM, as well as the Dexcom.
And so the way this works is the continuous monitor feeds data into the app and then uses that data along with you putting in the food to
Yep.
tell you how much insulin should be
Yeah.
given.
So to begin with, when a patient goes to calculate a dose, when they're about to eat their breakfast, lunch, dinner, or snack, when they go to the bolus calculator, their sugar will already be there based off what their CGM reads, their sensor glucose. And on top of that, it will show the Inpen app, and on the Insight report will show their trends. It'll actually show the trends on the app as well, but it'll show at what time did I take this dose and what did that do to my blood sugar. Did I take enough? Do I need to talk to my doctor? Do I need to take more at this time? But it will show real-time data and real-time trends exactly when you made a dose.
So once again, Jake, I want to say, let me pause and just say thank you for being with us today. Love hearing about that technology. So I have pulled up on the screen here the Inpen app. Why don't you just walk us through what we're looking at and how do we go about using this thing?
Yeah, sure. So this is the homepage of the Inpen app. So when you're about to eat, you will simply go to this app on your phone, just like you would any other app, and this would be the home screen. So on the top right there where it says take 3.5 units, typically that would say calculated dose. So Dr. Woode, if you'll hit that blue bar right there, that's where that's where you'll go when you're about to eat. So if you're wearing a Guardian Connect or even a Dexcom, that number would already be populated right there. Your sensor glucose would already be right there. If not, you can stick your finger and get your blood glucose that way. So you would get your blood glucose, Dr. Woode, say you're at 200 right now. And say we're going to eat a somewhat high carb meal. Say we're going to eat a sandwich and some chips. So maybe 100 carbs. So that recommends, based off your insulin sensitivity factor, your insulin to carb ratio, and your blood sugar goal. Some people is 120, some people are 100, some people are 150. You and your physician will find that out, or will decide that. And based off of, this is the program, this is Dr. Woode's, he would need 8.5 units. So he would simply hit save at the top right there. And once he makes that dose, once he takes the 8.5 units, that is now logged in the Inpen app. So that is his logbook right there, what you're looking at.
And then would I just hit take if I had a pen connected to this?
Yeah. So you'd hit actually anytime a patient makes a dose, anytime that is dialed up and taken, that is logged. So
okay.
the app and the app and the pen are talking 24/7. This cannot be pushed in without being recorded in the logbook. So if I shot this across the room right now, it would be recorded that I took 8.5 units.
Okay.
What's cool about it for a clinician like yourself is the reports tab on the bottom right there. And that would typically, after a few days of use, I would have a full report of what the clinician would want to see out of the patient. So it would have how many doses has this patient taken? What's the percentage of time that this patient is using their bolus calculator? Is the patient taking their long-acting insulin? And it'll show the real-time data on their charts. If it's connected to a CGM, it'll show the real-time data. When was that dose taken, and how much did it drop my sugar? So that is how the clinician can make dose adjustments. And whereas before the Inpen, we were relying on patients to bring in a logbook and tell their doctors how they felt and go off A1Cs. And this is it can be such a more precise therapy adjustment with real-time data.
Okay. Well, let's walk through this a little bit more. You mentioned correction and settings and so forth. Why don't we go there and just show the folks who are watching what that looks like? So do I go, I guess under settings is where I would go.
Yeah. So you're saying to take a correction or to show the active insulin?
To do our therapy settings.
Oh, okay. Yeah. So you would go to therapy settings.
Hmm.
Yeah.
And
So,
then,
so that's another thing to talk about. So are you ready?
no, yeah, go ahead. Hmm.
Okay. So this is the therapy settings tab. So either someone at your doctor's office can put this in, your doctor can put this in, your local Medtronic rep can put this in. Even you can put it in once the doctor gives you your prescribed settings. So one of the cool features on the Inpen is there are three uh, ways to use this pen. You can count carbs, you can estimate meal sizes, or you can have a fixed dose. So right now it's on the carb counting section, and basically to go through to the settings, what's important is you need to get your insulin to carb ratio, your insulin sensitivity factor, your goal, your blood sugar goal, and that's really it. You have to put that in one time, and you'll never have to do it again unless your doctor changes your sensitivity factor or your goal.
So basically, down here at the bottom, we would tell it what our insulin to carb ratio is. That's how much insulin do I get, or for 1 gram of carb, or so forth. So in this case, I'm telling the pump that I get 1 unit of insulin for every 15 grams of carbs. All right, so
Yep,
that's why my insulin to carb
exactly right.
ratio is 15. And the insulin sensitivity factor really tells the device, if I wanted to lower my blood sugar by 50 points, then it would give me 1 unit. So there are people out there who know, and with your doctor you would calculate it. There are some people who can tell you exactly, say, if I want to make my blood sugar go down by 32 points, I need to take 1 unit. And so this really, we set it to whatever that correction factor is, and then our target just tells it what number are we trying to get to as our normal number. So for some people, we tell them that we want their blood sugars to be between 100 and 120. So a lot of times I'll put that number at a 110, right? So I want you to correct down to 110. Or for some of our older patients, we'll do a higher number, maybe 150. For instance, if I have a 90-year-old man who has heart disease and diabetes and kidney disease and so forth and other issues, then I'll set it at 150, and that'll be what the device will correct to. So let's go back for a minute, and we'll say, so let's go back, and we'll say later, and let's make a calculation based on these new numbers. And so let's say that we do have a blood sugar of 200, and I think we had put in 100 grams of carbs, and you'll see that it now tells me to take 7.5 units of insulin,
Yep.
which is different than we had before. And this now is based on those new settings that we put in.
Yep, that's exactly right. Pretty cool,
Awesome.
huh?
It is. This is really neat. All right, so we're back. So that was good. I mean, looking at that app, I think a lot of people who are not necessarily right now interested in the pump would be excited to see that they are able to get some of the same benefits of the app in the Inpen. So they're still doing their pen, but they're getting some of the benefits that they would normally get from a pump.
Yeah, that's exactly right. I've even heard some people describe it almost as a portable pump. Now it's really not, because you're not getting basal insulin in the background
Mm-hmm.
from the pen, but it does have the calculators of a pump. So again, the idea is for the patient to guess less and live more, and the
Right.
idea is for the patient to get the right dose at the right time. And again, I told you those statistics earlier that 2/3 of patients struggle calculating a dose, and 60% of patients take insulin doses with insulin on board. And this is a way that they can help. This is a way that patients can get better time in range. We know now that A1C is still the gold standard, but time in range is almost the gold standard now. So this is a way that patients can get better time in range and feel better throughout the day, to stay in that 70 to 180 range, and to get their A1Cs in the 6.5 to 7 range at goal, depending on what organization you follow.
So Jake, so tell us a little bit. What do you see coming down the road? I mean, we're continuing to get better and better and better technology, and this is an amazing one. Like I said, because it allows me as a clinician to be able to see exactly what patients are taking, even though they're not using an insulin pump. Where do we go from here?
Yeah, so great question. As far as insulin pens go, I think smart insulin pens are absolutely the wave of the future for patients that don't want to be on pumps. I can't speak a ton on it. I do think at some point there will be a basal smart pen, or there will be an all-in-one smart pen with a basal and bolus option. So that will give patients the autonomy of not having to keep up with two different types of insulin all the time. That's what I would say is the next wave for smart pens. Do your own research. As far as insulin pumps, we know that a fully or personalized closed loop option is coming, and we do think that the technology is only going to get better. And
well, once again, man, thank you so much for spending some time. I hope you will allow us to invite you back, and so we can talk some more as this technology grows, and maybe we can talk about some other things. I do want to do for our viewers a complete demo of the app itself, how to set it up, how to get the Inpen connected, and even hopefully get a Dexcom that we can show how that works. Hey guys, thanks again for watching. I hope you have learned something. I hope you're getting some benefit from the videos that we are doing. If you are and you have not already done so, go ahead and hit the button below, hit the subscribe, hit the bell so that you'll be alerted when we do other videos. Share this with family and friends. Give us a thumbs up and like this video. And in the comments, drop us a line. If you're using the Inpen, if you're using a pump, if you're using any of the continuous glucose monitors, let us know what your experiences have been. Also, let us know what the other topics you'd like us to cover. We are building this channel as a place of support, as a place of education. Thank you for watching this video. We thank Jake once again for coming in. This is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and The Light Away, educating the public for a better you.